there any safe level of gluten for a person who has celiac disease?
This is a question that we've been asking for a long time because we know that people with celiac disease need to avoid gluten for the rest of their lives, but avoiding gluten not necessarily means zero. In biology, this concept does not exist. You're approaching to zero, and the question has been always, where is that cutoff? What is this threshold under which the vast majority of people with celiac disease are safe? So it's been an enterprise for many, many years, and we have some ideas in reviewing the literature and seeing retrospectively some data, but the power of this information is not as strong as if you design a study, you go prospectively. We have a few examples in the literature of those kind of studies that by definition could not be too large because of the ethical implication to ask an individual that is celiac and now treated on gluten-free diet to be exposed to gluten. But those few studies that have been performed seems to suggest indeed there is a threshold under which the vast majority of people with celiac disease are safe.
That applies to all kind of patients with mild or severe disease?
The concept indeed is to find the rule that applies to the vast majority of people with celiac disease. Of course, as any other phenomenon in biology, there are the tails at the end of the distribution curve. So it is possible that there are people that are exquisitely sensitive to gluten to be harmed even for small amounts that are safe for the vast majority of the remaining people with celiac disease. But I would say that those studies and the regulations that many, many countries are going through are based on a safe threshold that apply to the vast majority of people with celiac disease. There is no predictions based on your symptoms and the gravity of the symptoms when you've been diagnosed, if you develop this in childhood versus adults, how sensitive you will be. There is no such link.
But on average, what's that threshold?
The threshold is a matter of debate, but the vast majority of the studies, and therefore the vast majority of the country that have to put the legislation forward, seems to suggest that if you have below 20 milligrams of gluten per kilogram of products that you ingest, that is a safe threshold for the vast majority of people with celiac disease.
And how a doctor that has a celiac patient can transfer this knowledge to let him live a more normal life?
I think that the key element is indeed to have clear information of what is the state-of-the-art knowledge about this threshold. And this has been a confusing matter, and therefore this has created confusion in patients. I think that the clear message to pass to the patients that has been newly diagnosed with celiac disease are three. One is a permanent condition, you don't grow out of it, it will stay with you the rest of your life. Two, that eliminating gluten is the treatment for the disease. Celiac disease now, we know, is not a foodology, it's an autoimmune disease. So for celiac, the gluten-free diet is like insulin for diabetics. You got to take that as an embracement of lifestyle to stay healthy. And the third and key message is, when we say gluten-free, we don't mean zero. We mean underneath a threshold that your immune system cannot see the gluten because it's so minimal amount that definitely does not harm. These three key messages are the key and backbone to really communicate to the patient what are the rule of engagement once diagnosed with celiac disease.
Do you think that legislation and the rules we have for food industry are taking this into account?
I think that the time is maturing now because, in the past we have made many mistakes in managing the situation because there was no coordination. So in other words, the industry was going its way, the scientific community in a different way, and yet the legislator was independently trying to achieve the goal to regulate the industry of gluten-free products. Now there is an appreciation that this needs to be coordinated. It's the benefit of everybody to have a common denominator so that the industry and the scientific community will work together to suggest to the legislator what is the best way to approach a bill that will regulate gluten-free industry.
Are today any interesting studies ongoing on this subject?
Well, the one study that was completed actually a year ago and then was published was a study that indeed we at the Center for Celiac Research at University of Maryland performed just to achieve what we just mentioned. In other words, was time that the American government was trying to identify a threshold. The Food and Drug Administration, that is the component of the government that was put in charge to implement this bill, was interested to understand what kind of threshold to embrace, and therefore we work in coordination. We did this prospective study in which people with celiac disease diagnosed, already died, were asked in a blind fashion to be exposed to either placebo or increasing dose of gluten, and tried to find out after 3 months of this exposure what kind of changes we were looking at in the goal to identify a threshold that could be safe. And that was the study that suggested that if you have underneath that threshold of 20 parts per million, that will pretty much be safe for the vast majority of people with celiac disease. Studies like this are hard to do because ethically it's very complicated to ask an individual that's diagnosed, is treated, to be armed, if you wish, with a poison that is gluten, to find a different threshold. There is no justification to do that. So what's going to happen from now on, most likely, is that once countries will raise a specific threshold, prospective studies to see how patients will do on that kind of gluten-free product with that particular threshold will do over time, and this will tell us if indeed this threshold is safe for the vast majority of individuals. It's more or less like we do with any kind of drug. You know, you do your phase 1, 2, or 3 trials, and then only when the drug is given to the market to a large number of people, only the time we say if indeed the efficacy and the side effects that they were studied are still valid in large numbers, or you see something that you didn't see during these early stages. The gluten-free products will be pretty much the same.